Do you know why you are taking the medications that you are taking? Do you know what they do? Do you know how long that you are going to be on them or should be on them? These are all questions that we should know and we should ask our healthcare provider, but often there is so much of a rush at your doctor's appointment, or nowadays, even it's hard to access your doctor sometimes. I'm going to go over a report that talks about one of the big issues with medications and prescribing right now in healthcare. I hope you'll join me. I think you'll find this very valuable. We live in a day and age where healthcare systems are increasingly under so much pressure. And this is a concern because the person who will suffer from this is the patient. And the patient that knows how to advocate for their health, understanding what prescriptions they're on and why they're on them, and if these prescriptions are having the desired effect, is incredibly important. The patient that knows how to advocate for themselves, you, is going to have a better quality of life and better health outcomes. So overprescribing is something that we refer to as when a patient is prescribed medications that maybe are no longer adequate for them, no longer apply to their condition, maybe they are not serving them correctly. And this is something that is fairly widespread. And so we'll be discussing a report on this that was recently publicized, and I'll go over that with you. Reminder to always check with your doctor, pharmacist, or nurse before changing or stopping any of your medications. This report is for information only. This is not health advice, but if based on what you see, you think that you need to ask some questions to your healthcare provider, then you can certainly do that. But please do not make any changes to any of your medications without speaking to your healthcare provider first. So in 2019, 14.5% of Canadians aged 12 and older, which is roughly 4.6 million people, reported they did not have a regular healthcare provider that they see or talk to when they need care or advice for their health. This problem has only been exacerbated by the pandemic, and I know that this problem is not unique to Canada. Many viewers from the United States as well as the United Kingdom have reached out to me at different points saying that they also have difficulty accessing a healthcare provider like a family physician. The NHS reports spending on medicines increased sharply from between 15 to 18 billion in 2010-2011 to 18.2 billion in 2017 and 18. Over 1 billion prescription items were dispensed in primary care alone, with an estimated 10% being overprescribed, that is, not needed or wanted by the patient, potentially more harmful than beneficial, or having more appropriate alternatives. This is where the conversation with your physician or your pharmacist becomes vital. We often see in Canada patients that go from one specialist to another, and the follow-up in between there is sparse, if at all, and we don't see a lot of follow-up on medications. And so this is where we can start to see gaps in the healthcare system, and this is where patient care and patient outcomes can start to become compromised. 1/5 of hospital admissions among adults over 65 are the result of adverse effects of prescribed drugs. This is much less likely to happen if you have a family physician that you see regularly, or if you have a pharmacist that knows you and that can review your medications regularly. Here in British Columbia, we have a medication review service where if you're on 5 or more medications, you can sit down with a pharmacist and talk about your medications, go over them and see if these medications are the correct medications for you and see if they could be adjusted, sometimes to a lower dose or a different class of medication, sometimes eliminated. And so there are a few caveats with that, but there are a lot of provinces in Canada where you can do this. And I know that there are programs outside of Canada as well. So this is one way to help reduce the incidence of this type of hospital admission due to adverse effects. A key recommendation of the report that will be linked in this description is cultural change to reduce reliance on medications and to support prescribing practices based on shared decision making. And so we see now that there's coming to be a shift in healthcare where the patient is now becoming a player in their own treatment. One of the things that we see in practice sometimes is a patient comes in with a prescription and they haven't really been educated on the importance of that prescription, or that prescription maybe isn't convenient for them. Maybe they've been given an injectable formulation of something and it's not easy for them to get that injection done. Or maybe they've been given medication that is too expensive for them. And so we need to look at alternatives for that. If a patient is prescribed a medication but doesn't take it, we're not going to see the effect of that medication. And on the contrary, we're going to see adverse outcomes possibly by the patient not treating a certain condition. In the same sense, if we're treating a condition for a certain period of time and that prescription is never stopped and the condition resolves, then we see more adverse outcomes. We know that the more medications a person is on, the more likelihood we have of adverse effects, of drug interactions, of the patient actually not being able to take that medication properly, even remembering to take it. And so we need to involve the patient, and increasingly so, medicine is starting to involve the patient as an active player in their healthcare. And this involves you. And the more educated that you are about your medications and different therapies, the more you will have the ability to speak up and ask the right questions to your healthcare provider when you are needing some type of medical care. And that's what I'm trying to help you do here. Time pressures on prescribers, limited awareness and availability of social prescribing, which improves health and well-being by connecting people to community services. So we're going to start to see a shift where physicians are actually prescribing for things other than medication. And I will talk to you about that here in just a minute. Also, utilizing different community services and awareness of what types of services are available in your community. Many times you could see a dietitian in Canada if you had simply a referral to speak to a dietitian, but people honestly don't really know this. And some healthcare providers don't know either. But we are starting to see a shift, and this is going to become more and more important as healthcare services are under this incredible pressure, exacerbated by the pandemic, and patients are going to need to know what services are available and what to ask for, and as prescribing practices start to change. This report places a limited emphasis on educating and empowering patients. So it does place an emphasis, but it's somewhat limited, to know more about their medications or take ownership of their therapy. If you are taking metformin for type 2 diabetes, it's important that you understand what that does, how that helps to sensitize your cells so they can actually recognize insulin, right? If you don't understand why you're taking something, you're probably likely to stop taking it and maybe never follow up. And that can have adverse outcomes if you're not being followed. Now, one of the things that I enjoy doing the most is actually deprescribing and taking away or eliminating prescriptions that are not necessary for patients. And this is the issue of overprescribing. But allowing patients to be empowered to know more about their medications helps them to take ownership of their therapy. So I wanted to share this with you because we are going to start to see prescriptions for things that are other than medication, and increasingly so. Did you know that in the UK, doctors can already prescribe for certain sleep apps like Sleepio, and patients can actually get the use of an app covered by their extended health plan. And so this is something that is going to become more widespread. Did you ever think that a doctor would prescribe an app? And this is happening because we are actually seeing that digital technologies can be as effective, or digital monitoring can even be as effective as medication. And healthcare providers and extended benefits plans are starting to recognize this more and more. And so this news coming from British Columbia, where I am this week, was very exciting. So for mental health issues or people with certain physical issues, doctors can now prescribe a year-long pass to Canada's national parks, and that includes over 80 parks. Now, the quantity of these passes right now is limited, but we know that nature-based therapy has an incredible impact on our mental health. Medical research now clearly shows the positive health benefits of connecting with nature. This is a collaboration with Parks Prescriptions is now a breakthrough for how we treat mental and physical health challenges, and couldn't come at a better time as we continue to grapple with the impacts
of the COVID-19 pandemic on our daily lives.
So that was just a quick overview. I will have a link to the full report in the description of this video, but I wanted to share this with you because the issue of overprescribing and the way that prescribing is changing is very significant, and it is something that I think that the public definitely needs to be aware of, that you become an active member of your healthcare team, someone that knows how to ask certain questions and advocate, and also understand why certain therapies are being chosen instead of others. And that's part of what I'm trying to do on this channel as we move forward here, is to educate you on different medications, different classes of medications, how certain body systems work, so you will know how to advocate for the health of yourself and your family. So wherever you are in the world today, take some time to take care of your mental health. Do some deep breathing with the video that I'm about to show you. Get outside, do some physical exercise, and I guarantee you will not regret it. Thank you so much. Take care and stay healthy. Bye-bye.